Hello, gentlemen, and welcome. Today, I'm going to share with you 5 essential steps every man must follow to protect and preserve the health of his most private organ. Now, you might think you already know how to care for it. After all, it's been with you since birth. But what I'm about to reveal may surprise you. Because when it comes to men's intimate health, what you don't know can absolutely hurt you. We're not just talking about avoiding embarrassment or short-term problems. We're talking about long-term performance, confidence, fertility, protection against disease, and even the quality of your relationships. Stay with me until the end, because I'm also going to share a bonus tip that most men have never even heard about. Yet it could protect you from one of the most painful and frustrating conditions men face as they get older. This is not about myths, gimmicks, or internet rumors. This is medical truth explained in plain language. Before we dive in, I want you to share, and subscribe this channel. So, let's dive in. Why penis health matters more than you think. Let's begin with a question. When was the last time you thought seriously about your penis as part of your overall health? For most men, the answer is rarely. Some think about performance, others about appearance, but very few think about actual medical care for this organ. And yet, this part of the body is like a window into your overall well-being. Struggling with erections? That could signal early cardiovascular disease, changes in sensitivity. That might reflect neurological issues, unexplained pain or swelling. That can sometimes be an early warning for infection or even cancer. In other words, taking care of your penis is really about taking care of your entire body. As a urologist, I can tell you that the number of men who come into my office with preventable problems is staggering. So, let's go step by step through the 5 essential practices you should never ignore. Tip number 1. Keep the blood flowing. Activity is essential. The penis is, first and foremost, a vascular organ. That means its function depends heavily on blood flow. Just like the heart, the brain, and the muscles, it needs oxygenated blood to stay healthy. Think of it this way. Imagine a bicycle that has been left in the garage for years without being used. The tires go flat, the chain rusts, the frame stiffens. That's what happens to any organ that isn't used. Now, I'm not saying you need to overthink this. What I'm saying is that regular activity, both physical and sexual, is essential. Here's why. Sexual activity, arousal, and erections all bring fresh, oxygen-rich blood to the tissues. This prevents scarring and stiffness. Physical exercise like walking, swimming, or cycling improves circulation throughout the body, including the pelvic region. For men who, for medical or personal reasons, are not sexually active, there are still options, such as pelvic floor physiotherapy, or even medical devices like vacuum pumps that stimulate blood flow. The point is this: disuse leads to dysfunction. Keeping the organ active is not about performance alone, it's about health maintenance. Tip number 2, cleanliness and proper hygiene. Now, this may sound obvious, but you'd be amazed how many men either ignore hygiene or practice it incorrectly. Let's talk facts. In certain parts of the world, including my own country, penile cancer is still tragically common. And one of the biggest risk factors? Poor hygiene. The penis, particularly in uncircumcised men, is prone to accumulation of secretions, sweat, and bacteria. If these are not cleaned away regularly, they can lead to irritation and inflammation, recurrent infections, long-term changes in tissue that, over years, may progress to something far more serious. So here's what I recommend. Wash daily with gentle, fragrance-free soap. Think glycerin or neutral soap. Avoid harsh chemicals. Rinse thoroughly and dry completely. Moisture breeds bacteria and yeast. After sexual activity, wash again. Remember, the vaginal environment has a very different pH balance from penile skin. Mixing the two without cleaning can disrupt your natural flora and cause irritation. It may sound simple, but simple hygiene saves lives. Tip number 3, protect yourself from microtrauma. This is one most men have never heard about, and yet I've seen it in my clinic far too often. Here's the problem: engaging in sexual activity with only a partial erection. When the penis is not fully erect, the tissues are more vulnerable to bending, stretching, and microscopic injuries. Over time, these small injuries build up. The result? Scar tissue, painful nodules, and in many cases, Peyronie's disease, a condition where scar tissue causes the penis to curve painfully during erections. Trust me when I say, men with Peyronie's disease often tell me it is one of the most frustrating and humiliating experiences of their lives, and it is often preventable, so be mindful. Never force activity when you're not fully ready. Never bend, twist, or use your penis in ways nature didn't design it for. Respect your body, and it will respect you in return. Tip number 4, the brain-body connection and mental health. Gentlemen, let me emphasize something that often gets overlooked. Your brain is your most important sexual organ. Every erection, every sensation, every response begins in the nervous system. The chemicals released in your brain during arousal, dopamine, serotonin, oxytocin, are what trigger the cascade of signals that result in physical performance. Now here's the problem we see in modern life: overstimulation of the brain through pornography and artificial stimuli. Let me explain. The brain has a reward system. It responds strongly to novelty, to new images, new faces, new situations. When a man consumes pornography excessively, he is flooding his brain with an endless supply of novelty. Over time, the brain adapts. It requires stronger and stronger stimuli to achieve the same level of arousal. The consequence is what we call sexual desensitization. In practice, this means difficulty achieving or maintaining an erection with a partner, decreased sensitivity during normal intimacy, a sense of dependence on pornography or artificial stimulation. Now, I am not here to moralize. What I am saying is purely medical. Excessive pornography use alters the brain's reward circuits in measurable biological ways. If you want to protect your long-term function, you must practice moderation. That means being conscious of your consumption, setting limits, and understanding that nothing can replace the richness of real human connection. This is why, in my professional opinion, maintaining good mental health, stress management, healthy relationships, limiting overstimulation, is just as vital to penile health as hygiene or exercise. Tip number 5, lifestyle habits and their direct impact on sexual function. Let us move now to perhaps the most important factor of all, your lifestyle. There is a simple principle in medicine. What is good for the heart is good for the penis. Why? Because erections are fundamentally a vascular event, an expansion of blood vessels. Anything that harms your blood vessels will eventually harm your ability to achieve or sustain an erection. Consider the following. Smoking. Nicotine and other chemicals in tobacco cause blood vessels to constrict, damage their lining, and accelerate hardening of the arteries. Multiple studies show that smoking is a direct, independent risk factor for erectile dysfunction. Alcohol. While moderate drinking may not cause lasting harm, chronic or heavy alcohol use damages the liver, reduces testosterone, and impairs nerve signaling. Over time, this translates into decreased libido and weaker erections. Diet. Diets high in saturated fats, processed sugars, and refined carbohydrates contribute to obesity, diabetes, and vascular disease. All of these increase the risk of erectile dysfunction and other urological problems. Physical inactivity. A sedentary lifestyle weakens circulation, increases body fat, and reduces testosterone. Lack of activity is one of the most consistent predictors of poor sexual performance in men over 40. Mental stress. Chronic stress elevates cortisol, which suppresses testosterone and interferes with arousal. Anxiety and depression are both major risk factors for erectile dysfunction, not because the penis is broken, but because the brain-body connection is disrupted. So, what should you do? Adopt the same practices recommended for cardiovascular health. a diet rich in vegetables, fruits, whole grains, lean protein, and healthy fats. Regular exercise, at least 150 minutes of moderate activity weekly, adequate hydration, proper sleep, at least 7 to 8 hours per night, eliminating or minimizing smoking and alcohol. Think of it this way: every cigarette smoked, every night of poor sleep, every missed workout is not only affecting your heart and lungs, but also your intimate life. Bonus tip: the role of sleep and hormones. Now, as promised, let me share a bonus tip, one that is rarely discussed but critically important. That is, the role of deep sleep in preserving testosterone and sexual function. Men produce the majority of their testosterone during the night, particularly in the deepest stages of sleep. When sleep is cut short, fragmented, or poor in quality, testosterone production suffers, and low testosterone has profound consequences: reduced libido, difficulty achieving firm erections, fatigue, mood changes, and loss of muscle mass. Studies show that even 1 week of restricted sleep can reduce testosterone levels by up to 15%. That is a massive decline in such a short time. So what should you do? Maintain consistent sleep schedules. Avoid screens and stimulants before bed. Create a dark, quiet, cool environment for sleep. Address conditions such as sleep apnea, which not only harm sleep, but also increase cardiovascular risk. Gentlemen, I cannot stress this enough. Without proper sleep, all other efforts will be undermined. Sleep is not just rest, it is medicine. Putting it all together. Let us now step back and review. The 5 essential practices for protecting your sexual health are: maintain regular blood flow and activity. Practice proper hygiene daily. Protect yourself from trauma and injury. Safeguard your brain-body connection by moderating overstimulation. Adopt healthy lifestyle habits: diet, exercise, stress control, no smoking. Gentlemen, if you have listened carefully and apply these steps, you will not only preserve your sexual function, but also improve your overall health and quality of life. Remember, health is not built in a single day, but through consistent daily habits. I encourage you to share this knowledge with other men who may not be aware of it. Speak openly with your healthcare provider if you notice changes. Do not suffer in silence. Thank you for your time and attention. I hope this lecture has been valuable to you. Stay healthy, stay informed, and take care of yourself.